Against all these threats and challenges to life, constant progress of research in life science and tight collaboration in relevant industry chains, better vital quality. Originated in 2002, RWD has been constantly furnishing customers with reliable solutions and services in life science, animal health and clinical medicine, and dedicated for better vital quality within our wits and powers. Our products have been sold to over 100 countries and regions around the globe and won worldwide customer confidence and support. At RWD, we launched 6 solutions in the fields of life sciences, animal health, and clinical medicine at the forefront of the world, including animal surgery and modeling solutions, in vivo imaging solutions, neural signal research solutions, histopathology solutions, animal diagnosis and treatment solutions, which evaluate diagnostic efficiency and treatment efficacy of surgery with anesthesia, dental services, rehabilitation, and physiotherapy, urinary system diseases, etc. And our assistants, science researchers, have published thousands of papers in a number of world-leading academic journals, including Nature and Science. On top of that, many scientific research institutions, medical institutions, and pet diagnosis and treatment centers have attained their success by leveraging our 6 solutions up to now. We will maintain cooperation and innovation with an open mind, boosting growth within many industries through joint efforts with our partners.
So we've been collaborating and cooperating with RWD for quite some time now, and their self-developed products have helped us in the laboratory maintain accuracy and improve accuracy. We're really happy with RWD's products, and we're really excited to see what they've got in store, their future products that they have in store for the future, and helping researchers worldwide.
Mein Name ist Dr. Heinrich Kollebusch. Ich bin seit 30 Jahren praktizierender Tierarzt und seit 20 Jahren beschäftigen wir uns schwerpunktmäßig mit der Narkosetechnik in der Kleintierpraxis. Uns Tierärzte treibt das Wohlergehen unserer Patienten an, sowie die ständige Verbesserung ihrer Lebenserwartung und ihrer Lebensqualität. RWD hilft uns dabei mit hochmoderner Beatmungstechnik und ebenso modernen Lösungen für Diagnostik und Therapie. RWDs Hilfe können wir Tierärzte sicherer und effizienter operieren, aber gleichzeitig sorgt RWD auch für eine verbesserte Lebenserwartung. Das Wohlergehen unserer Patienten und die ständige Verbesserung ihrer Lebenserwartung und Lebensdauer treibt uns Tierärzte an.
As a national high-tech enterprise, RWD ascribes great importance to technology research and development, based on 4 technical platforms, including optical imaging, precision transmission, accurate temperature control, and detection of weak signal. We have a grip on leading core technologies across many fields. Since RWD's founding, the company has invested hundreds of millions on research and development, gaining almost 100 patents, both domestic and international, as a result. In addition to a sound manufacturing base, advanced processing assembly line, and precision detection system, RWD has built an integrated control system that monitors all aspects of operations from research and development to manufacturing. The name RWD comes from the transliteration of the English word reward, meaning payback to society. Reward is not only the original aspiration of the creation of RWD, but also the continuous belief of the company. In 2016, RWD launched the RWD Preclinical Medicine Enlightenment Scholarship to help with the development of research talent in China's preclinical medicine. So far, the scholarship has been awarded to 38 institutions of higher education nationwide. As the Vice President Unit of the Huxley Wildlife Conservation Society, RWD has donated medical equipment and supplies for wildlife relief and the conservation of the natural ecosystem. In 2020, RWD donated clinical medical supplies worth over RMB 1 million to the Giant Panda National Park to help with safeguarding our national treasure. In the future, RWD will continue to contribute its wits and powers to enhance vital quality and help global customers unlock vital mystery and safeguard vital health.
Hello, everyone. This is Nico from RWD Life Science. Welcome to the RWD Vet Academy. RWD is a life science company focusing on animal health. We have been founded for more than 20 years, and we have veterinary anesthesia machine, ventilator, dental unit, laser therapy, and many other best-selling products in the world. So we study RW Vet Academy, hoping to provide more services and knowledge to our users. Now, please allow me to introduce the theme and the lecturer of this academy to you. The theme of this academy is laser surgery, and we are so proud to have Dr. Winkler speak for this edition. He is a fellow and faculty member of the American Laser Study Club. This is an organization dedicated to assisting medical practitioners in advancing their surgical laser knowledge and skills. And he also sits on the editorial board of this journal. Dr. Winkler has appeared nationally as a laser surgery instructor and lecturer for veterinary conferences such as the NAVC, the WVC, and the AVMA. And as a speaker of laser photobiomodulation for the ASMS, the Great Smokies Veterinary Conference, and the Colonial Veterinary Conference. He also contributes articles on laser therapy and laser surgery for veterinary practice news and has acted as a consultant for multiple laser surgery and laser therapy companies. Dr. Winkler is the 2021 recipient of the Kumar Patel Prize for Outstanding Contributors to Veterinary Laser Surgery Education. Now, let's welcome to Dr. Winkler.
Thank you. Thank you, Nico. Thank you very much to RWD for hosting us today. Welcome. It's a pleasure to join you here from Long Island, New York. Let me just share the screen. And can you all see and hear me okay? Very good. A brief disclosure today. I have no commercial relationships to declare. I have received compensation to speak with you today about surgical lasers. I am not an RWD animal healthcare employee. I am a private practitioner in New York using lasers and these techniques for the benefit of my patients, and this presentation represents my own professional experience with them. So there are now advanced, less painful hemostatic laser surgical instruments, a wide variety of them, available today from which all veterinarians and their patients can benefit and enjoy. Instruments like the CO2 surgical laser that removed this benign trichoblastoma from between the plantar foot pads of a golden retriever. You can see here, in spite of this difficult location, how deftly the mass was removed without bleeding or harming the underlying pedal vessels. What a tremendous asset to you and your practice to have such surgical instruments at your disposal. And these instruments are catching on very quickly. An internet search will show you that many animal hospitals across the world are now proud to offer laser surgical services, such as this diode laser, used to rapidly remove a small skin mass on this pet without any bleeding. To not take up this instrument is to fall behind on what many clients are now actively seeking in today's veterinary world. It has never been easier to obtain a laser instrument for your practice now, be it general or specialty. But how do you know that you're choosing a genuine surgical laser or the right one for your needs, and then learn to use it safely while getting the fullest use out of it that you possibly can? I didn't happen to know even those very questions myself in 2010 when a representative for a laser surgery company stopped by our clinic one day, and I decided to implement their trial period. My first surgical laser was this CO2 laser. Its maximum power at the time was about 15 watts with an even lower super pulse value. That's not the most optimal or versatile power you would presently want for laser surgery. It was water cooled, which is not the easiest to maintain. It always seemed like I was spilling a little water inside the laser each time I tried to top it off. It also had an articulated arm delivery system, which was very heavy and inflexible and a strain on my hand and wrist. The lens was all the way at the back of the handpiece back then, and the focal point of the beam at least a centimeter away from the handpiece's tip, usually more. Sometimes I had to hold it as much as an inch away from the tissue for optimal results. After being trained with a scalpel blade in direct contact with the patient, I can't tell you how difficult it was to hold this handpiece so far from the patient without a built-in guide. And you can see the low power settings we were using 12 years ago. Now, I know it sounds like I didn't like it, but I was still very impressed with the excellent results I was obtaining with that instrument. And I used it for the next 5 years. Of the benefits spoken of surgical lasers, less bleeding, less time taken to perform a surgery with less pain and scarring and faster healing times, I witnessed them all, and they were all making me quite taken with laser surgery. We began branding our practice with this service, and as I learned more about it, I developed an intense interest in laser medicine and surgery and what it could do. I started by reading as much as I could about laser physics, tissue interaction, and case studies, and taking courses in wet labs and laser surgery. Courses such as these, especially hands-on courses, have really helped advance my knowledge and understanding of laser safety and to learn to utilize programmable features such as superpulse. This all helped me to plan for laser procedures and use the laser much more effectively in my practice. What also improved is my ability to share communication of laser concepts more effectively with my clients, other laser professionals, and my colleagues. So I learned that there are lots of different surgical lasers available out there, but for the majority of veterinary soft tissue procedures, there are three ways to use one: to incise or excise, to vaporize or ablate, and to coagulate for hemostasis. The results you wish to achieve mostly depend on the laser's own wavelength and on the particular tissue on which you're operating. You need to have sufficient power to achieve your surgical goal, and then finally practice the amount of time you apply the beam to the surgical target tissue. Apply those tenets to whatever surgical laser you have on whatever it is you happen to operate. Laser surgeons learn to obtain their best possible clinical results by mastering the power delivered by the laser, measured in watts, the power density applied at the handpiece, and the amount of time the laser is applied to the site. Figure A represents a laser wavelength that is well absorbed by tissue, as we have a rapid tissue incision or ablation with minimal collateral thermal injury. A nice example of a superpulse incision of skin. Figures B and C represent what can happen when a poorly absorbed wavelength is used on a tissue, so it takes longer to do the task you're trying to perform. Figures B and C are also what can happen when you're using a well-absorbed wavelength, but you're using it at a very low power level, or if you're keeping the laser's energy in contact with the tissue for an extended period of time. Bear in mind, figures B and C might be what you want to achieve for your procedure, for destruction of a tumor, for example. So these two instances are not necessarily bad effects, but there are techniques to go about this while sparing surrounding tissue we would want to leave intact. And this begins with a well-selected laser wavelength. Regarding power density, just as the force of water from a garden hose is increased by decreasing the diameter of the hose at the tip with an attachment, we can also control the power density of the beam by decreasing the diameter of the fiber optic or of the handpiece itself to increase the laser energy delivered over a smaller area, and vice versa. This relationship follows an inverse square law. Decreasing the spot size by 50% will increase that power density across the spot by a factor of 4. So what different types of surgical lasers are available to us now? There's the erbium YAG laser, which is also well absorbed by water. This laser incises slowly compared to the CO2 laser with less hemostasis and a very short penetration depth. It's useful for operating directly on teeth, vaporizing the water in the interstitial spaces of the enamel and dentin. I got to see my children's pediatric dentist use it to drill their cavities with a lot less pain. The ND-YAG laser was one of the first lasers to be used for veterinary applications. Its fiber optic transmission made it a natural choice for upper respiratory, soft palate, guttural pouch, and urogenital endoscopic procedures in equines. The holmium YAG laser is also transmitted through fiber optics. It can be used in wet environments. Its effects are thermal, about 10 times that of CO2. Its applications are very situational. For instance, here it's very useful for neurological procedures, such as disc decompression in canines as an alternative to laminectomy. But two of the most widely available lasers for veterinary surgical procedures are the diode and the CO2 surgical lasers. Diode lasers come in a wide variety of wavelengths. They use laser light to superheat a treated fiber optic tip to over 500 degrees Celsius to cut and cauterize tissue in direct contact. The laser light itself isn't making the actual incision. CO2 lasers are of a single wavelength that work by boiling intracellular water at a very consistent 100 degrees Celsius. This provides for a precise and consistent cut with less penetration depth and collateral thermal damage, and no trauma from physical contact between tissue and instrument. Carbon dioxide lasers are strongly absorbed by water with very low levels of scattering and reflection and a very short penetration depth. They're excellent for precise incision, excision, and ablation for most of our practices, general veterinary soft tissue procedures. The wavelength of diode lasers in the 800 to 2000 nanometer range, it's easily reflected, it's absorbed by pigments like melanin, and it's often scattered more than absorbed by the target tissue. This makes it less precise for surgery, but also excellent at coagulation. So very early on, I made a conscious decision to use a laser for every soft tissue procedure I do. Taking the time to set up and incorporate the use of the laser and try different settings for different procedures and situations increased my confidence in its everyday use. I most often use a laser for spays, neuters, and mass removals. The most notable uses for lasers I can think of are BOAS cases, oral surgeries, surgeries of the nose, pinna, and ear canals, eyelid surgeries, cystotomies, and perianal surgeries. I would definitely not attempt surgery such as a soft palate resection or a mass removal from the urinary bladder or ear canal without a laser. Our practice has since switched to a more powerful CO2 laser for general surgeries. This model's power goes up to 45 watts continuous wave with a super pulse of 30 watts, abundantly more than enough for the surgeries we typically perform. It is air-cooled and it's nearly maintenance-free. It's mostly involving taking care of the flexible hollow waveguide delivery system and its lens. With the added power and a wide array of programmable options, this is an excellent surgical laser for most soft tissue procedures in day-to-day general and specialty practice. It will expand the practitioner's range of procedures they could not perform as effectively without one. The handpiece is also much more ergonomic than the older conical one I was previously using. With a hollow waveguide delivery, it's lighter and far more comfortable and flexible than the articulated arm. This laser's lens is much closer to the tip of the handpiece, making the focal point just a few millimeters from the tip, allowing you to operate up close to the tissue, such as in this entropion patient. This laser is also very effective at opening a cat bite abscess with minimal sedation. The cauterized, slow-healing wounds allow the abscess to heal without the need to insert a drain, and these cats appear much more comfortable in their recovery as a result. CO2 lasers enable you to achieve very fine incisions. Just look what happens when the laser handpiece tip is not held perpendicular to the tissue. You can see where the collateral thermal damage zone at the word lasers is a bit wider due to the greater difficulty I had writing at the top of this curved hemisphere compared to writing in the middle. So it's very important to maintain the distribution of power across the beam's geometry to keep your results consistent as you incise. Do this by keeping your handpiece as perpendicular as possible to your target tissue. This reduces the chances of reflection of the beam as well, increasing safety and maximizing the beam's efficiency for good results. Smoke plumes are a serious safety concern with lasers, particularly CO2. The CO2 laser vaporizes cellular water that can create carcinogenic plumes that can even carry live viruses. A smoke evacuator is thus an essential piece of safety equipment for laser surgery, and it should be held very close to that plume, as close as you can get it without breaking sterility. We also use 0.1 micron surgical mask to filter any remainder of the plume that escapes the evacuator. Unlike diode surgical lasers, it's very important not to touch any tissue with the CO2 laser handpiece. There is an optimal focal point of distance to the tissue with these lasers, and any tissue entering the handpiece will carbonize within it. That'll decrease the beam's diameter and alter the power distribution across the beam. That can adversely affect your equipment and your patient. Also, please don't use the handpiece to touch the buttons on the laser console. This is not something covered under your warranty, yet it remains a common cause of damage to a laser console. Instead, touch the buttons with a syringe plunger, put one in with each of your laser handpieces and surgical packs, and if you tape a shallow cup to the side of the laser, be it CO2 or diode, you can store the plunger out of your pack right next to the control panel and still touch only the end of the plunger with your gloved hands to program while you're gloved in. A groove director, pictured at the bottom, ensures that you're not lasing underlying structures while you're incising, such as at the linea alba and in cystotomy. The blades of the groove director are also a convenient backstop on teeth when performing epilus removal or gingival resection. Just take care with the reflection caused by this and other metal instruments. Cystotomy is a very satisfying procedure with a CO2 laser. This laser here is set for a 0.25 millimeter spot size at 15 watts continuous wave superpulse. It offers great hemostatic control. Postoperative hematuria and discomfort have been non-existent in the cases we've seen. Just have a feel for how you're going to approach aseptic control with the laser's handpiece. If the stone is large enough, use the stone itself as a backstop as you open the lumen. And you can see just how little bleeding has occurred in this surgery. Following closure of the bladder lumen, but before abdominal closure, I have my licensed veterinary technician use a therapy laser in non-contact fashion. Its application can help reduce inflammation and make the patient much more comfortable post-operative. And we use the therapy laser again on closed abdominal incisions such as this spay. We do this routinely for any procedures not involving possible neoplasia or danger to the eye. This model's beam can be narrowed to increase the power density across the beam width. That way we can use it in a non-contact mode to prevent mechanical tissue trauma. This Labrador was diagnosed with transitional cell carcinoma by urine antigen test, but you can't get false positives on those results, so it's a good practice to confirm the antigen test result with the surgical biopsy. After exposing the bladder, we could palpate the mass easily, and we were able to approach alongside it at 0.25 millimeter spot size and 10 watts continuous wave in a superpulse setting. But this mass was quite large, but it was on a very narrow stalk projecting from the bladder mucosa. After applying a Miller's knot to the stalk, we excised it at the same spot size and 15 watts continuous wave non-superpulse. Biopsy revealed a non-neoplastic nodular mass secondary to chronic urolithiasis and or cystitis, not a transitional cell carcinoma. So we were very pleased we went in there for biopsy rather than just rely on the urine antigen test. The patient did very well postoperative with no hematuria or difficulty urinating and has had no recurrence since. The surgical correction of elongated soft palate and stenotic nares are procedures I simply would not attempt without a laser. This is a video of what these patients look like when they come into us. Here's another case of brachycephalic obstructive airway syndrome, or BOAS, in a 1-year-old Boston English Bulldog mix. He's under light sedation with dexdomitor at this point, but you can still get an idea of his airway problems through his breathing pattern. The outstanding clinical sign was his snoring, and the clients were told it would only get worse with age. The same dog in sternal recumbence. He's under propofol induction at this point, but he's not yet intubated. You can see here the elongated soft palate ready for marking with the laser. I have since found Alice forceps ideal for grasping the tip of a soft palate, while DeBacchi forceps are very useful for manipulating the palate and the nares as you incise. A smoke evacuator attachment for the handpiece is more efficient for keeping the patient's airway clear and assists in visualization. So check with your laser's manufacturer for such an attachment for your unit. So at this point, the soft palate is grasped and manipulated in front of the epiglottis. Minimum tension is applied to the tongue, allowing the tissue to relax for marking where we're going to make our incision. We're going to first mark that soft palate with the CO2 laser, set for 6 watts repeat pulse at 10 milliseconds and a 5% duty factor, using a spot size of 0.4 millimeters. You can see the smoke evacuator attached to this handpiece. That's a plus in such tight quarters there. The epiglottis and the caudal pole of the tonsil are used as a guide to mark the elongated soft palate, tracing a dotted line with the laser at very low power. A deep plane of anesthesia helps to prevent collateral thermal injury during this part of the procedure. And here's the rough mark of our incision line across the soft palate. You may just make out the line traced by the laser on the soft palate here. The patient is then intubated, and we drape both the ET tube and the area behind the soft palate with plenty of saline moistened gauze. Then we set our laser for 25 watts continuous wave at non-super pulse, while kept at 0.4 millimeter spot size, and the soft palate is incised at the level of the previously made mark. Incise the soft palate from either end towards the center while maintaining tension on the forceps. At this high wattage, the incision is made very rapidly using the laser with no hemorrhage observed. Be certain you have the patient's throat and the ET tube well draped under a thick layer of moistened gauze. And there's our excised tissue. Now I keep the patient in sternorecumbence for a following sternotic nares procedure, the head positioned on a rolled towel for access. You can see here how closed the nares appear, and also the steps taken to protect the eyes and the endotracheal tube with moistened cloths. Poiseuille's law suggests that a 50% reduction in the radius of a tube leads to a 16-fold increase in resistance to airflow. Therefore, correcting the stenotic nares plays a major role in relieving the pathology of brachycephalic obstructive airway syndrome. The CO2 laser provides superior hemostasis to a surgical blade with increased precision and visualization. The procedure begins by marking the incision line. We're again setting the laser for repeat pulse at 4 watts in a super pulse mode, 10 milliseconds and 5% duty factor, using a spot size again of 0.4 millimeters. Both sides are marked before proceeding to excision. This allows comparison of the nares during marking, and it also decreases the time spent programming the laser. But once you have both nares marked for incision, grasp the ventromedial aspect of the alar fold with your forceps and apply a lateral tension. And with the laser at 10 watts continuous wave and a 0.4 millimeter spot size, mark a point as far proximal as possible and trace a superficial incision in an isosceles wedge. The base of that triangle is made by the dorsal and ventral points of the initial external marking on the nares itself. And the apex of the triangle is a point made proximally on the medial aspect of the alar fold. Just watch the patient's nasal septum here. Once you have this wedge traced, then excision is continued with the same laser setting. A superpulse may be used here to minimize thermal collateral injury, and non-superpulse may be used for maximizing hemostasis. You could also either one here, depending on the situation. The process is then repeated on the other side. Now, at this point, the external alar fold has been removed, but the alar cartilage ridge is still present, and that can continue to restrict the airflow. Its removal is extremely difficult with a scalpel due to the extreme hemorrhage, but with good technique, it's very simple to ablate with the laser. The most important part of that ablation of this cartilage is to protect the lateral aspect of the nasal septum. This will prevent stricture formation during healing. I use saline moistened cotton-tipped applicators to protect the nasal septum and to wipe free any char after each pass with the laser. Alar cartilage ablation is performed at the same setting. An alternate setting is 0.8 millimeter spot size at 10 to 20 watts continuous wave in superpulse mode, depending on the amount of tissue to be removed. Using the moist cotton as a backstop, the laser is repeatedly swept from dorsal to ventral and ventral to dorsal on the lateral aspect of the cotton. After several passes are performed, that moistened tip is used to gently remove the char on the tissue, and you just repeat this process until that alar cartilage ridge has been removed proximally enough to be able to insert that cotton-tipped applicator with ease. And here's one of these noses on completion. An otoscope can also be used to visualize the nasal cavity. We typically send these patients home with an e-collar and an oral NSAID or steroid. We've done about a dozen of these cases or so in the last year, all of them extremely successful, and the clients were very pleased with the results of the pet's breathing. Here's another patient and his new nose just 1 week post-surgery. These BOAS cases, especially the stenotic nares cases, can take time to fully recover. And the first few times you and the pet owner are witness to this, it can be quite disconcerting, especially when these noses look so great, fresh out of your OR, just when the healing is just getting started. So patience is key here. It's not uncommon at all to see temporary depigmentation of the nares, a nasal drip, very dry noses, sneezing out desiccated debris, incessant licking of the nose for 1 to 3 weeks following this procedure, though most of them are doing quite well in under 2 weeks. You do see lots of sniffing as well. The patient is very happy to be sniffing again. Remember that this is not a cosmetic procedure. We are improving function to the pulmonary system and this poor animal's major sense organ in a single morning. And there may even be behavioral changes as the animal's breathing improves. Those are for the better. Protect that medial septum during surgery, then treat them supportively and give them adequate time for recovery, which can take 2 to 3 weeks. One of the most frequent safety issues one can encounter with the use of the CO2 lasers is the reflection of laser light, especially off of metallic surgical instruments. If the tissue you're cutting or ablating is being held by a metal instrument, such as an ovarian pedicle within a clamp, aim your laser at the tissue without hitting the instrument. Reflecting off the instrument can occur randomly around the OR, making eye safety paramount. It can rebound right back at you, hitting your fingers, and at the very least, probably requiring you to re-glove. It can ignite surrounding drape material and damage the patient. You can use a moist backstop to help prevent this. And don't hit your technicians. Please protect your eyes with wraparound lenses. The optical density or OD number for each different laser wavelength will be printed right on the frames. CO2 laser safety glasses come as goggles, which can be worn over glasses, or inserts which can fit behind your own glasses. Prescription eyeglasses are typically not wraparound and will not protect you adequately from stray reflected rays. Remember that you may have to switch between different OD safety glasses if you're using more than one laser wavelength in the same room. You can't necessarily use one for the other's laser unless it has the right OD number. Regardless of eye protection, the laser beam should never be stared at or directed into eyes. The wraparound inserts are great if you're using magnification loops, even with glasses or contacts. Dystechia are another rewarding case for the CO2 laser in general practice, although finding them on the exam is not so easy if the pet doesn't let you look that close, or if the client has gone and plucked it out before bringing the pet into you. I had to send someone home once to wait for it to grow back before taking the pet to surgery. 5-watt controlled single pulse burst in non-super pulse mode is just enough to destroy the follicle, and then you're nearly done. Get up very close to these, but be very careful not to let the follicle enter the handpiece itself. It can make it difficult to clean afterwards. Now, I say nearly done because where there's one dystechia, there's often more. While the patient is still out, thoroughly check all those eyelids very closely for any other dystechia present. There were 4 in all on this one particular patient. And as always, be sure to hold the handpiece as perpendicular to the tissue as possible here. Lasers have been documented as ignition sources. Their much hotter operating temperature can be a great concern if there's pure O2 from a masked small animal, such as pocket mammals and lab animals. That doesn't mean it couldn't happen with other patients if you have mask leakage of anesthetic gases in the vicinity. So take what steps you can to avoid such leakage and accidents for any laser procedure. And to prevent any stray shots from becoming an ignition source in the perianal area, such as a methane near this mast cell tumor, carefully pack the anus with moistened gauze first. Now, with this tumor removal, I started this procedure with a defocused 4-watt continuous wave beam to trace my incision. You can also use a pulsed beam at low power to trace your path before incising, just as shown in the Boas patient. Then I'll switch to a 0.25 millimeter spot size and increase the power to 25 watts continuous wave in a non-superpulse mode to excise the mass. You can see how fast the laser operates at higher power with no hemorrhage. You can also see how closely that smoke evacuator is being held to the patient and how effectively it's taking in all that smoke as a result. It's very important for safety. For the final bit of tissue to be excised, we use wet gauze as a backstop to protect the drape and the underlying skin. And there's no hemorrhaging at the site there. On completion, just remember to remove the gauze from the anus. And this mass was completely excised with no recurrence. Now, we also added a diode surgical laser to our practice as soon as we could for greater versatility in our procedures. The power density of diode laser light can be altered by using different diameters of fiber optic waveguides, pictured there on the left. The device at the top right is the laser's foot trigger. The optical fiber tips can be threaded into the operating channel of an endoscope or otoscope, or through a handpiece for manipulation, seen here at the lower right with a pen for comparison. When using a handpiece for applications such as skin incision, The tip is treated just prior to surgery to create high temperatures for incising. Companies often offer diode surgical and therapy laser wavelengths and options within the same unit, further increasing the versatility of this instrument for veterinary practice and your surgeries, especially compared to electrocautery. The flexible fiber optic waveguide delivery of diode laser light makes them excellent for use in endoscopy and otoscopy. Their wide variety of wavelengths and operation in submerged environments also make them very useful for specialized veterinary procedures, such as photodynamic therapy, treatment of periodontal infection, bladder stone removal, and for use on tumors and highly vascular tissues. For example, diode lasers are very useful for ear surgeries where excessive bleeding is very common. Buddy is a 6-year-old neutered male, mixed breed, who was scheduled for a dental prophy, but he also had this lump on his right ear, which was not bleeding or painful. I was asked to remove this mass at the time of the dental procedure. With the ear clipped and prepped and some gauze in the canal against possible bleeding, we're using a 400 fiber, and the diode laser is set for 30 watts continuous wave at a low thermal setting, about 700 degrees Celsius. The diode tip is drawn across the tissue, creating a clean incision with no bleeding observed. It is very common to see a great deal more char with these diode lasers than the CO2 laser, especially without superpulse. You will want to keep constant tension on that mass during excision to facilitate its removal until it's finally off. So we have the mass following removal, and here's the incision site left open to heal by second intention. No bleeding occurred postoperatively. Buddy was sent home with a topical antibiotic and an e-collar. Biopsy revealed a benign chondroma. The excision was complete and expected to be curative. Here's Buddy's ear about 1 week after surgery. And 3 weeks post, it resolved very well. But between diode surgeries, the optical fiber and the handpieces and tips of a diode surgical laser are autoclaved. On opening, the surgeon will hand one end of the optical fiber, shown here at the left, to an assistant for attachment to the laser, while the surgeon then threads the other end of the fiber through the handpiece and a selected tip, shown at the right, and prepares that tip for the procedure. This 6-year-old spayed female American Staffordshire Terrier had a very large mass on the tip of her left pinna. The growing mass was present for about a year before we saw her, and her left superficial cervical lymph node was also enlarged. I plan to remove the tip of the pinna and submit it for biopsy with the lymph node. So I removed the lymph node first before moving on to the pinna resection portion of this procedure using the diode laser. The excision is made using a 600 fiber, and the diode laser is set for 25 watts continuous wave and operating temperature of about 1400 degrees Celsius. The first incision is made very rapidly across the skin, and then it's repeated with a second pass deeper through the cartilage. So here's a video of the procedure. One gently draws the heated tip in direct contact across the tissue incision line. It's a bit different technique from the CO2 laser. No bleeding occurred at all during this laser procedure. And here's the remaining pinna ready for closure. Now it's very important to oppose the skin and cover up that cartilage in these places. Allow this wound plenty of time to heal postoperatively with an e-collar on. I gave it 3 weeks prior to suture removal. Here's the ear's appearance at closure. This ear healed very well postoperatively. Here it is at 1 week and 2 weeks, and at 3 weeks in suture removal. And not all ear masses are this accessible. An otoscope with a port for a hollow waveguide or fiber optic laser delivery will expand your laser surgery practice even further. Myringotomy, ablation of ceruminous cystomatosis, and polyp removals are all much easier with these instruments, with less bleeding when a laser is combined with them. Now we have here an 8-month-old neutered male domestic shorthair hospital mascot of one of my colleagues. The presenting clinical signs of this cat included increased inspiratory breath sounds over time, with intermittent open mouth breathing, signs of a partially upper airway obstruction and discomfort. There was also history of copious mucus from the nose and mouth, which were controlled but not eliminated with antibiotic therapy. Oral exam revealed a soft tissue mass hanging down the back of the throat, seen here when the soft palate is directed dorsally. This was causing significant and audible stridor and mild respiratory discomfort for this cat. Masses such as these can arise from ceruminous glands of the ear or from the nasal mucosa, making it difficult to reach their source without an endoscope or otoscope. Lacking an otoscope, my colleague was wondering if I could just laser this off, just enough to improve the animal's quality of life and reduce or eliminate the dyspnea. The diode surgical laser was ideal for this, given its hemostatic potential and the very moist environment. Here's a video of this mass's excision. The mass was excised using a setting of 5.6 watts, a pulse width of 1 millisecond, and a spot temperature of approximately 800 to 1000 degrees Celsius. With 2 people retracting the soft palate and 1 person operating the surgical laser, I was able to manipulate this 600 fiber optic very close to the mass's visual root appearance in the nasopharynx. While manipulating the mass in my other hand with the forceps, I've removed the handpiece and I'm just manipulating the fiber itself for more flexibility in these very tight quarters. Now, this is possible because the laser light is not heating the entire fiber, it's only heating the prepared tip. Passes were made very gently over that pedunculated region of the mass with the fiber, with periods being taken between passes to wipe away char and mucopurulent discharge until the pharyngeal portion of that mass is resected. Only minute thermal trauma was noted to the soft palate behind the mass. The rest of the mass could not be visualized by eye or camera following the procedure, but the improvement in mucopurulent drainage was immediately apparent and no hemorrhage was observed during the procedure. This is the mass postoperatively for submission to a biopsy. And the cat did quite well in recovery. Biopsy showed a benign non-neoplastic nasopharyngeal polyp arising from cystic hyperplasia of the nasal mucosal glands. Culture results were positive for Pasteurella, and this responded well to post-op antibiotic therapy. To date, there have been no recurrence of clinical signs or the associated mucoid exudate. He was very active with a good appetite following the surgery, and he was no longer breathing with an open mouth. Despite not being able to excise that mass at its source, both the biopsy results and the improvement of the cat's clinical condition demonstrated the value of the laser in performing this procedure. For those of you performing mobile surgical services, by all means, take these lasers out on the road with you. With the CO2 laser, a smoke evacuator and stand, an autoclaved handpiece, and a diode surgical and therapy laser to tag along, this equipment will even fit in a compact car for a mobile surgeon to travel between veterinary hospitals, where they can set up in just a few minutes and be ready for another surgery. So going forward, some important points to remember are when using a CO2 laser, avoid direct contact between the handpiece and the tissue. Practice keeping a consistent hand speed and a consistent focal distance in accordance with your selected spot size. If you hold it too close and you could touch the tissue, if you hold it too far away, you'll increase the spot size and decrease your power density, and then you'll widen your cut well, taking longer to incise and do more collateral thermal damage. When using a diode laser to make incisions, observe for any fractures of a fiber optic tip within an incision and increase your hand speed. Remember that hemostasis and minimizing adjacent thermal trauma are mutually antagonistic. Laser hemostasis requires thermocoagulation of a vessel. You've been trained in alternatives to achieve hemostasis, so in the meantime, try using high power and power density while applying it with a more rapid hand speed compatible with your coordination. And also try increasing the power to see what works for you in your procedure in particular. Apply tension to the skin edges to incise more efficiently with the laser. Wipe char away between passes to avoid collateral heat buildup in adjacent tissue. Practice using moist gauze, a groove director, or other backstops behind your laser to protect other surrounding tissues from stray beams and thermal effects. Continue to develop your safety skills regarding eyewear, your patient, and your staff members around you. And try a new setting you haven't tried before that may be more suited for your needs in your practice. For incisions, first select your power and then continuous wave or a pulse beam or super pulse mode. If you're going too deep, increase your hand speed before you decrease your power. But don't change your spot size or your distance from the tissue. If you're not going deep enough, increase your power. Don't slow your hand speed or get closer to the tissue than the optimal focal depth. For ablations, you're going to use a low wattage setting than for incisions. Defocus your laser by increasing the spot size or use a wide ablation tip. Ablate back and forth with consistent hand speed and distance from the tissue and wipe the char off in between. The tissue removal should be rapid. If it's not, then change what you're doing. If it's too deep, don't decrease your power first, Increase your hand speed and then widen the beam if you can. If you're not deep enough, then increase your power. The American Laser Study Club, or ALSC, is an organization of doctors, dentists, veterinarians, nurses, and veterinary technicians who all share a common interest in laser medicine and surgery. We meet annually to present case studies and welcome you to present your own. And we all learn a great deal from each other at these interdisciplinary venues. The ALSC also has an annual journal and is developing certification courses in laser physics, tissue interaction, and safety. Laser safety officer certifications are also available through the Laser Institute of America. The American Institute of Medical Laser Applications offers certification courses online for medical and veterinary practitioners and for nurses and veterinary technicians. These courses are wide-ranging in the veterinary field, from science and safety to applications in both companion and equine medicine. The American Board of Laser Surgery also offers certification courses for all medical practitioners using lasers in their practices in an effort to train medical professionals in laser physics, tissue interaction, equipment, and safety. Courses from any of these organizations are highly recommended for anyone looking to include the use of a laser in their career. Excellent resources are also available at fine bookstores everywhere to continue learning the science behind laser surgery and have a look at specific case studies and suggested laser settings for reviewing and adapting to your own procedures. Such settings remain suggestions for you. A carpenter's apprentice does not memorize the number of strikes a carpenter makes on a nail with a hammer, but rather learns the carpenter's techniques and applies them to their own desired results. The same analogy can be said of laser surgery and the application of laser settings. Thank you all very much for joining us today. Thank you very much to RWD. Special thank you to my staff for their photographs. Are there any questions?
Thank you very much, Dr. Winkler. Can you see the questions on the screen?
See if I can bring it up.
No. Did you see the question?
Bringing them up now. I have a Q&A here. Yes.
Yes.
Okay, thank you. When using the laser for the removal of eye polyps, will it hurt the retina? Very much so. Laser wavelengths are very damaging to the retina at diode laser wavelengths and to the cornea in CO2 laser wavelengths. We cover the eye itself with moistened gauze or with an eye shield. Eye shields are commercially available today at many venues and on the internet. So it is very important to cover that eye, I guess. You've seen a laser surgery with a pulse mode. Will the pulse mode affect the continuity of the cut? The pulse mode will pulse the beam, so the beam is not cutting constantly as with a continuous wave beam. The pulse mode is very effective for a lower power ablation, or if you're very concerned about just slowly removing tissue. It's very effective at marking for a later high power incision, which is typically made with a continuous wave beam. If a diode laser is placed inside an endoscope, are there any special requirements for the endoscope and any possibility of damage to the endoscope? That's an excellent question, and I would leave that question to the manufacturer. You do want to let them know what laser wavelengths and power outputs you intend to be operating at, so that you can check with the manufacturer and see that those wavelengths and power outputs are indeed safe at the endoscope. You've tried a laser procedure with fiber optics. Good afternoon, by the way. But the hemostasis was not satisfactory. What could be the cause? Possibly that the power or the power density was not high enough for hemostasis. I would recommend considering increasing the power, as we talked about at the end of the presentation. Many lasers are offered at much higher power than what we were used to even just 10 years ago. And these higher power outputs are making our procedures much more rapid with the hand speed very comparable, if not the same, as a surgical steel, but still with greater hemostasis. So I would recommend looking into practicing increasing the power of the laser for greater hemostasis. The difference between evaporation of the laser and the electrosurgical unit. The difference we find with the evaporation of lasers is a much narrower cross-section of collateral thermal injury to the surrounding tissue compared to the electrosurgical unit. Electrosurgical units are typically less expensive, but they may cause more collateral thermal trauma and increase for a risk of electric shock in the operating room. Is it justified to set higher charges for laser surgery? I would agree. Most of our surgical laser charges are incorporated directly into the surgical estimate rather than listing them as a separate line item. This is because we only perform our procedures with lasers. We don't typically offer them as an option. I believe that laser surgery is much more beneficial to the patient and much easier for the clinician to operate with than surgical steel. And therefore, we don't leave as an option for laser surgery. It is incorporated into all of our procedures and incorporated into the estimate as a result.
Okay, thanks again, Dr. Winkler.
Thank
And
you.
this brings us to the end of today's academic. If you need more information, you can send us either an email or follow our social media just as shown in this screen. And also we will put our reply on this social media. And we will announce our next academic on it. Thank you. Thank you for your time.
We had one more question, Nico, if
Okay.
to wear eye protection goggles while operating the laser diode on tissue cutting. If it's being directly viewed, then I would recommend it. It may not be as dangerous as the CO2 laser, but it's still a risk if the fiber degraded at all. But when the laser light is operating in such a channel as an endoscope or an otoscope, it's not being directly viewed. You're viewing it through the camera, and thus the eye protection may not be as necessary. Just use great caution when you're setting up the laser for the endoscopy or otoscopy so that you're protecting everyone's eyes. Thank you. Thank you for that question.
Thank you. Thank you again, Dr. Winkler. And this will be the end of our today's academic. Thank you. Thank you all.
To deliver RWD-RLT24 veterinary laser therapy uses class 4 high-power lasers to deliver non-invasive, deeply penetrating, fast-healing treatment. The therapy is applicable to a wide range of symptoms. With better pain relief and minimal side effects, it helps to reduce pain, relieve inflammation and edema, and accelerate tissue repair and healing. With more than 1,300 built-in treatment procedures, this easy-to-operate therapy can be used to treat a range of diseases in cats, dogs, horses, and exotic animals. The maximum average power of the therapy reaches 24 watt, with fast laser energy transmission and reduced attenuation. This product can be used to treat both large areas and deep tissues. In addition, course of disease can be reduced by more than 40%, while pet compliance is also easier to achieve. CW, pulse, and ISP emission modes help achieve the effective transmission of laser energy tailored to disease severity. ISP mode reduces the filtration of light by the surface tissue, making it suitable for the treatment of deep tissue ailments. 650 nanometers, 810 nanometers, 950 nanometers, and 980 nanometers laser wavelengths are available for different cases, allowing for a wider scope of clinical application. With 5 different treatment heads, veterinary can easily choose a treatment method according to the size of the treatment area, further improving laser transmission efficiency. Quadruple protection. The laser's operation is further optimized through TEC active temperature control and internal fan, while the fiber protection disc and anti-warping connector protect the fiber from damage. Interact with the machine through the 7-inch HD touchscreen. Hit the emergency button to stop operations at any time. Watch the demonstration video to help you get started. Shine the laser, the pain disappear. RWD Veterinary Laser Therapy optimizes your healing process. RWD-RLT24 Veterinary Laser Therapy uses Class 4 high-power lasers to deliver non-invasive, deeply penetrating, fast-healing treatment. The therapy is applicable to a wide range of symptoms. With better pain relief and minimal side effects, it helps to reduce pain, relieve inflammation and edema, and accelerate tissue repair and healing. With more than 1,300 built-in treatment procedures, this easy-to-operate therapy can be used to treat a range of diseases in cats, dogs, horses, and exotic animals. The maximum average power of the therapy reaches 24 watt, with fast laser energy transmission and reduced attenuation. This product can be used to treat both large areas and deep tissues. In addition, course of disease can be reduced by more than 40%, while pet compliance is also easier to achieve. CW, pulse, and ISP emission modes help achieve the effective transmission of laser energy tailored to disease severity. ISP mode reduces the filtration of light by the surface tissue, making it suitable for the treatment of deep tissue ailments. 650 nanometers, 810 nanometers, 950 nanometers, and 980 nanometers laser wavelengths are available for different cases, allowing for a wider scope of clinical application. With 5 different treatment heads, veterinary can easily choose a treatment method according to the size of the treatment area, further improving laser transmission efficiency. Quadruple protection. The laser's operation is further optimized through TEC active temperature control and internal fan, while the fiber protection disc and anti-warping connector protect the fiber from damage. Interact with the machine through the 7-inch HD touchscreen. Hit the emergency button to stop operations at any time. Watch the demonstration video to help you get started. Shine the laser, the pain disappear. RWD Veterinary Laser Therapy optimizes your healing process.